Well, for more on how we can tackle obesity, we're joined by the President of the Australian Medical Association, Dr. Steve Hambleton in Brisbane. And Steve Hambleton, how would you sum up the health risks of obesity?
Well, the health risks are quite large and growing, and we heard some estimates there about the impact on our community, and $50 billion is a lot of money. We know about the increasing risk of type 2 diabetes, we heard about stroke, about hypertension and some cancers. And people don't realise that the obesity can lead to some cancers, and really it is a major public health risk. It's possible that this generation will be the first generation ever that doesn't outlive their parents, and that's really disturbing.
Now, studies have shown that obesity is more likely to affect lower socioeconomic groups. Can we make that link, that those groups who eat fast foods are therefore more likely to be overweight?
Well, sadly, there is a link. In fact, the UK work that's been done in this area can actually predict obesity levels based on your suburb, based on your socio-demographic level, and which is really disturbing. And the very people we've got to be trying the hardest seem to be accessing the fast food, the high-fat, sugar and salt foods more for convenience and for other reasons, and even for price. We've got to make sure that healthy foods are affordable and cheap and available, and the education about how to use them is available for everyone, particularly those areas.
We talk about education. Is that working as far as educating people on the dangers of overeating?
Well, it's beginning to work, you know, and I guess we see commercial entities like Disney, like our fast food chains actually introducing healthier meals. And it's really gratifying to see that some of our fast food chains now headline with, you've got 5 or 6 healthy alternatives if you come and see us. You know, it's starting to happen, which means the population is really demanding that. Now, these commercial chains respond to the community, and if the community starts to ask for better, healthier meals, that's the outcome we'll get. So it'll be a virtuous cycle if that continues, so people do actually seek healthier foods, but we've got to educate people also with the food labelling, and we know the government in Australia has been slow on change in better food labelling, so at a glance you can see whether something's good or not.
Well, let's say education is the carrot. What about the stick? And some European nations are considering taxing fast food, and as mentioned, in New York they want to ban some of those larger sugary drinks. Is that the answer?
Look, I think governments do have a role here, and I think it's very courageous of Michael Bloomberg in New York to make this suggestion. But he's talking about drinks that are over 600 ml in size, and carrying something like 15 or 20 teaspoons of sugar. It should be a no-brainer, really. That we should avoid that sort of level of sugar when you're having a meal. So governments certainly do have a role. In Europe, we see there's the fat tax, inverted commas, being proposed, and that is making high-fat, sugar and salt foods more expensive. But gee, that's only going to work if we can make healthy foods less expensive. We certainly don't want to penalise people who enjoy every now and again some fast food. And we're saying that this is not unhealthy, it's just unhealthy if you eat it all the time.
Steve Hambleton, can I just move on to another issue, that of the Healthy Kids Check, a government initiative to screen 3-year-olds for early signs of mental illness. Now, this is not going to be compulsory, but are there some concerns about this, perhaps the chances of misdiagnosis?
Well, there certainly are, and at an early stage, at the age of 3, look, there's a lot of normal behaviours that can be disturbing to parents, and we've really got to provide parents with the opportunity to say, your child is actually normal, and by the end of the year, those behaviours will change. Now, the difference between a 2-year-old playing, often alone by themselves, not interacting with their peers, and a 3-year-old who will start to become more gregarious and start to play in friendship groups with other children is chalk and cheese. And so at the beginning of 3, that one behaviour might be seen as abnormal, but by the end of 3, it's quite normal. So we've got to be very careful that these are actually positive and helpful to parents, and don't label kids. The last thing we want to do is medicalise normal behaviour.
So, do you actually support this check then?
Well, yes, we do, and that does need evaluation. And the important thing is, if we can say to parents, look, that behaviour is by itself, it's not global. You know, there are no other clues that might make us think that this is abnormal. You can be reassured, just step back and wait. So if parents that come out of it saying, well, yes, I'm happy that I'll just need to watch for this and watch for that, not come out with a label for a kid that's otherwise normal and developing normally, I think that'll be a good outcome. The last thing we want to do is provide medication for children when they're just behaving like normal 3-year-olds.
Dr. Steve Hambleton, thanks very much.
Thank you.